Good day and welcome to today's webinar, Athletics in the Era of COVID-19, Vaccine and Return to Fall Sports Updates, presented by the Athletic Healthcare Administrator Association and the U.S. Council for Athletes' Health. My name is Dr. Jim Borchers. I'm the President, CEO, and co-founder of the U.S. Council for Athletes' Health. And we appreciate the record turnout for today's webinar with over 650 registrants. And we all hope that you will find the discussion today engaging and information valuable. Our panel today of sports medicine and infectious disease physicians and specialists are prepared to discuss the safety and efficacy of the COVID-19 vaccine, risk mitigation strategies, and the potential impact of Delta variant this fall, in addition to reviewing and answers to common questions submitted before the discussion. Before we dive in, I need to review just a few housekeeping items with you. Your camera and microphone will not be available during the presentation. However, we encourage you to use the chat function to submit questions and participate in live polls. For athletic trainers looking for continuing education credit, a certificate will be sent via email after the course. And an email will also be sent to all attendees with course evaluation survey. We appreciate feedback from all of our participants. And remember, you must complete the survey to claim the continuing education credits. I'm looking forward to just a really robust discussion today. And without any further delay, I'm really honored to introduce our panelists to you here today. Our first panelist is Chad Asplin. Chad is well known to USCAH and to the AHAA. He's a sports medicine physician and professor of family medicine and orthopedics at Mayo Clinic and serves as an associate for our organization. He's also the past president of the American Medical Society for Sports Medicine and team physician for the U.S. Ski Team, USA Basketball, and USA Triathlon, among others. Dr. Doug Ackerman is with us today as well. Doug serves as our executive director for the Athletic Healthcare Administrator Association, as well as the senior associate athletic director for sports medicine at Samaritan Health Systems in Oregon State University. He's a sports medicine physician and administrator with over 20 years of experience in Division I collegiate athletics. We're really happy to welcome back today John Schwartzberg. Dr. Schwartzberg is a clinical professor emeritus at UC Berkeley's School of Public Health and chair of the editorial board of the School of Public Health and Wellness Publications. He's board certified in internal medicine and infectious diseases and has served as a national expert on COVID-19 and the return to sport for many organizations. And very happy today to welcome Cameron Wolfe. Dr. Wolfe is a nationally recognized infectious disease expert at Duke Health and is an associate professor of medicine at the Duke University School of Medicine. He also chairs the ACC's medical advisory team and is the leader of Duke University Medical School's coronavirus task force. As I mentioned, I'm Dr. Jim Borchers, and I'm really honored to be the moderator today with all of our experts. Today, we're going to be discussing athletics in the era of COVID-19. We were here a year ago, and we're back here today with some changes and differences, with the new variant, with vaccines, and with questions about a return to fall sports. And so we're ready to begin today's discussion and looking forward to hearing from our experts here today. So, gentlemen, and to all our guests, welcome. The first topic that we want to discuss today, and I think I'll open this up to Dr. Schwartzberg and to Dr. Wolfe first, is to talk about vaccine efficacy and safety. There's been a lot of discussion, especially amongst athletes. I think when we see recently in the Olympics at Tokyo, questions about vaccination. There's been a lot of discussion in pro sports leagues, certainly discussion around collegiate sports, and now even entering into high school sports and youth sports, and the recommendations that are coming from different areas about vaccination. And so maybe both of you could comment on vaccine safety and efficacy as it pertains to athletes and the questions that they might ask, and giving them some information about vaccine efficacy and safety. So I guess, Dr. Schwartzberg, maybe if you could start, and then maybe we could have Dr. Wolfe with his comments.
Sure. Thank you, Dr. Borchers. Well, I guess I'll start with safety by saying that I was one of the first people in line to get the vaccine because I was very personally satisfied with its safety and efficacy. But much more importantly than what I did is look at how many millions and millions, hundreds of millions of people have received these vaccines. People often say, well, they're new and we don't have a lot of experience with them. We have an enormous amount of experience with these vaccines. and they are remarkably safe. Frankly, I think they're a lot safer than, for example, taking aspirin on a regular basis or some other non-steroidal anti-inflammatory drug on a regular basis. These are very safe vaccines, and there's plenty of experience to bolster that statement. Secondly, in terms of efficacy, I'm going to take you back to a little over a year ago. Here we are in, let's say, September, knowing that around the corner are going to be these vaccines, because it was pretty clear that we would have something within the next few months. The FDA said at that time that they would approve a vaccine if it showed 50% efficacy, because that would have a profound effect on the pandemic. I personally was hoping for 70% and feeling a little gluttonous about that, but I was really hoping for 70%. And we wound up with vaccines that are in the 90% plus range in terms of efficacy, far exceeding anybody's expectations, safer than we could have hoped for, and more efficacious than we could have hoped for. So fast forward to today, and we'll get in, I'm sure, to a discussion about the Delta variant. But if you fast forward to today, these vaccines are still holding up quite well. I got my last jab on January 30th. 2 weeks later, I was fully immunized. I'm not anxious that I need another booster right now, because the data suggests that it's working real well. What data am I talking about? It is very, very, very unlikely that someone well over 65, is going to wind up in the hospital from COVID if I got infected or die from it. And that's all we really prayed for a year ago. So safety, absolutely. Efficacy, absolutely.
Dr. Wolf, your thoughts on vaccines?
Yeah, and thank you for the invite. I mean, I completely agree with John. I mean, you think back to where we were a year ago, boy, I don't know that I was gunning for 70%, John, but I was certainly hoping for something better than 50 like you were. And to see 95% when the first Pfizer data was reported from an efficacy was almost too good to believe, until then the second Moderna vaccine came out and essentially sort of cross-validated each other in terms of using a similar approach, different companies, different trials, and yet they came out with the same protection. And that was really reassuring to me at the time, because it sort of really cemented that, yes, this is going to be incredibly helpful for us. And I think it's been pleasing since to sort of, we're now closing in on 350 million doses domestically, plus a lot more internationally. And that is a wealth of safety data that really has not posed us any concerning features. I would agree with John that these have been, standout vaccines from a safety perspective as well. When we think of efficacy, I look on my inpatient side of the world where I see patients in our hospital, and I basically don't see vaccinated patients in the hospital. It's remarkable. If you've had a vaccine, the chance of you meeting me in the hospital is almost zero. And that is very different than where I stood a year ago. And I think that may be, for our athletic people specifically, who tend to be younger, healthier, fitter, and active individuals, I kind of also look at it from a different perspective, because they were never in the highest risk category to land in the hospital for the most part anyway. But that doesn't mean that they don't get the potential for significant impact due to COVID. And the kinds of things that I have seen with some of our athletes and players here, for example, are some of those other issues that we are beginning to grapple and wrap our heads around with COVID. So we've had individuals who've had multi-system inflammatory issues due to COVID. We won't expect to see those because they're now vaccinated. We've had issues with people getting sort of the more long COVID symptoms, where they've been quite fatigued and sort of just not got back to their performance level that they had in the past. They were never severe enough to land themselves in the hospital, but that kind of COVID is equally what I'm, very grateful that these vaccines can now prevent. So I completely concur with John. These were far in excess of what I would have hoped for a year ago. I'll end with that.
So Dr. Wolf, you mentioned, kind of the difference, Cameron, the difference between maybe what I think some people think breakthrough infection versus breakthrough disease. And I think it's important, and certainly Doug or Chad, you can pipe in here as well, but I think it's important for people to realize what we're talking here is preventing breakthrough disease, which you mentioned, Cameron, which is not ending up in the hospital, not requiring significant intervention. We know we mentioned Delta variant can cause potentially breakthrough infection, but it's the severity of that infection and leading to disease that vaccine has really impacted significantly, at least as far as we know.
Yeah, no, that's absolutely right. I mean, people read statistics, particularly we're seeing coming out of Israel and the UK, where, the rate of infection post-vaccination with Delta is higher than what we saw 6 months ago. That's true. But their impact on preventing severe disease is still profound. And that, I think, is really worth hammering home, is that if I have turned this, even for someone who does happen to still get COVID, into a mild upper respiratory flu-like illness, then compared to what we were seeing, 12 months ago, that's still a huge impact.
Chad and Doug, any comments on that issue, especially amongst college athletes?
Yeah, I want to just put things back in kind of reference a little bit. There's a lot of media and press about breakthrough infections, but if you look at the CDC website and look at the stats on the number of infections that are occurring between vaccinated and unvaccinated, there are 98+%, 97+% of all the infections that are occurring right now are unvaccinated. And the breakthrough infections are really only making up about 1% to 2% of the infections that are being tested. Now, the question is, are there others that are flying under the radar because they're not symptomatic? And that's truly something we can grapple with. But I think it's really important that people realize that if you are vaccinated, you have a lot of protections. And if you're not vaccinated, you're really at risk. You're at huge risk. And I think that's important for our student athletes to know.